Dr. Brooks has a disclaimer that the topics to be discussed have the potential benefits of AI in medicine. Potential. However, you've heard Dr. Topol. There is quite a bit of literature already in other areas of medicine. This lecture will deal with the radiologic aspects, radiology, and if you want to read, you will find it in Radiology, American Journal of Radiology, 223, October 2024. And the introduction is basically what we're going to talk about, and I will be limiting some of the text because Dr. Topol had mentioned some of what would have been discussed by Dr. Brooks. However, there will be a discussion on thermal technologies, which already you've heard about. And the emphasis will be on the role of radiology, particularly in reading X-rays, MRIs, and CT scans. Well, first, let's look at the AI in diagnostics. Image analysis. AI can assist in reading X-rays, CT scans, and MRIs with increased accuracy. For example, AI algorithms can detect early-stage cancer in radiology imaging. And in pathology, as you also heard from Dr. Topol, AI identifies patterns in pathology slides faster than manual interpretation. So this is I call it the radiologic aspect of pathology. They're dealing with images. They're looking through a microscope. An example in pathology is the identification of malignant cells in biopsies. What about using AI in predictive analysis? And you heard that again from Dr. Topol. Here, AI can help in early detection of medical issues. For example, AI can predict heart disease and other diseases, many of them you've heard already, based on patient history and risk factors as well. So patient monitoring is the incoming things, ladies and gentlemen. You need to know that because you'll be using wearables. Patient monitoring using AI has accelerated in recent years. Continuous monitoring through wearable devices combined with AI are used for early warning signs of deteriorating health. Another area of AI is used in the personalized medicine. And that, again, you've heard from Dr. Eric Topol. Here it is used in treatment, which is becoming more precise, and AI helps in tailoring treatment plans based on individual patient data. For example, AI models can predict which cancer treatments will work best for a specific patient based on the genetic profiles. And importantly, this drug discovery and this year, two Nobel Prize winners were awarded the prize for their work on the molecules, how molecules can be folded and how they can produce compounds. So this is important, therefore, and predicting their efficacy of the drugs. AI can help in administrative tasks. You will have a lecture on that. But briefly to mention that automating routine tasks like scheduling, billing, and documentation, natural language processing is used for automating clinical notes, and we'll show you an example of that. You don't have to write. You don't have to have any papers in front of you. on your desk. That's not necessary anymore. AI can also assist in resource allocation by optimizing hospital resource use, such as bed management and staffing. The ethical and privacy concerns will be discussed by other doctors later. However, they will cover areas involving patient privacy, bias and fairness, and transparency. And all I want to mention here is that we as physicians and healthcare providers, we should be balancing AI-driven efficiency with the need for transparent, ethical decision-making in patient care. So what are some of the practical uses of AI in radiology and neurology and neuroradiology? Well, the role of AI in radiology is to assist radiologists by enhancing accuracy, reducing diagnostic time, and enabling faster decision-making. Well, how does that work? Well, it works using the machines that we already mentioned. The machine learning and deep learning algorithms, they analyze the large data sets of medical images, and they learn to identify and find the abnormalities or anomalies with minimal human input. Minimal human input. Machine learning extracts patterns from labeled medical data to learn diagnostic criteria, and the deep learning that we mentioned and computer vision process complex image data such as MRIs and CT for in-depth analysis. Let us look at the use of AI in neuroradiology. Well, there's automated detection. AI algorithms, particularly convolutional neural networks, are trained on large data sets of brain images to identify specific conditions like gliomas, meningiomas, and hemorrhages. Excuse me. For instance, AI systems can highlight abnormalities in MRI scans that indicate conditions such as multiple sclerosis. This offers a second opinion to the radiologist, and it also enhances sensitivity. Studies have shown that AI can improve sensitivity in detecting conditions such as Alzheimer's disease by recognizing patterns on structural MRI scans that signify early neurodegeneration. AI is also used in mammography. Dr. Topol mentioned the X-rays of the chest. X-rays of the chest are read by AI on par with radiologists, with 90-some% accuracy, as I understand it from the literature. AI in mammography is great for early detection. It can improve the detection of breast cancers in mammograms by identifying tiny, suspicious areas, sometimes years before they're visible to the human eye. And studies have shown that the use of AI in mammography can reduce false positives and false negatives, thereby improving diagnostic confidence. Now, is there a real impact of this using the AI? Sure. AI can reduce unnecessary follow-up procedures, and it can increase the chances of detecting early-stage cancer, breast cancer, which is often more treatable. So the automated segmentation is another area that is phenomenal. With AI, it can segment the areas. Here, you can get precision in measurement. AI tools can automatically segment critical brain structures such as the hippocampus, the amygdala, and tumors to provide precise volumetric measurements. This is particularly useful in longitudinal studies where tracking changes over time is essential for monitoring disease progression or treatment response. And then there is consistency. Automated segmentation helps reduce inter-observer variability. That ensures that measurements are consistent across different studies and radiologists. What about risk prediction? There is predictive analysis. Machine learning models can analyze patient demographics, clinical history, and image features to assess the risk of conditions like stroke or dementia. For example, an AI model might predict the likelihood of a patient developing Alzheimer's based on their baseline MRI findings and cognitive scores. How about proactive interventions? Well, by identifying high-risk patients, clinicians can initiate preventive strategies such as lifestyle modifications or early therapeutic interventions. Well, what about workflow optimization? You will have a lecture on that later on in the next segment. So I won't spend time, but you will be seeing how AI-driven automation is done and case prioritization. And so what are the benefits of workflow optimization in radiology? They can streamline the workflow, reduce the radiologist's administrative workload, and there is faster turnaround for diagnosis and reporting. Another area fascinating in radiology and in all medicine, actually, is the personalized treatment plans through radiogenomics. AI can analyze imaging characteristics alongside genomic data to correlate specific imaging phenotypes with genetic profiles. For instance, certain imaging features in brain tumors might predict responses to targeted therapies, thereby guiding treatment decisions. And then there is tumor characterization. By integrating radiogenomic data, AI can help differentiate tumor subtypes and can influence therapeutic choices. Quality control is critical. Image quality assessment. In AI algorithms can evaluate image quality in real time. They can detect artifacts, for example, motion or metal-induced artifacts in real time. And those might compromise diagnostic quality. In doing it in real time, this ensures that only high-quality images are analyzed, which leads to more reliable interpretation. There is another element in quality, it's called the feedback loop. AI can provide feedback by technologists during the imaging process, suggesting adjustments to improve quality before the images are finalized. So the AI agent would be helping in that regard. Then there is integration of the radiologic findings with the electronic medical records. Here, the AI can pull relevant patient data and clinical notes from the electronic medical records. That's the AI can do it, not you, and not the doctor, not the human person. But the AI can do that and present them alongside imaging findings. This holistic view may aid radiologists in making more informed diagnoses. Streamlined reporting is another important aspect. AI can assist in generating preliminary reports that summarize findings and suggest potential diagnoses based on imaging data. This allows the radiologist to focus on more complex interpretations. Then there is the training and education in radiology. This applies also to all medicine. The interactive learning, AI systems can create a dynamic learning environment where radiology trainees can practice interpreting cases with real-time feedback. This helps improve their diagnostic skills and confidence. And then there are simulated cases. AI generates synthetic imaging cases with varying degree of abnormal findings, providing trainees with a diverse range of scenarios to learn from. And don't forget teleradiology and telemedicine. Remote consultations are important. AI algorithms can provide preliminary assessments of scans sent for remote review. That allows the radiologist to prioritize their workload. Then there is supporting underserved areas, and that's very critical. We want to improve care in rural or underserved areas. The predictive modeling can be used for treatment outcomes. Outcome prediction models, AI can analyze historical data on treatment outcomes based on imaging characteristics, and clinical decision support is helped by integrating the predictive model into the clinical workflow, and that enhances clinical decision making. Well, okay, we've talked so much about the good. Let's talk about some of the limitations and the limitations of AI in radiology. First, the data quality issues. You've got diverse data. AI models require diverse, high-quality data to generalize across different populations, but often they lack adequate representation. And then you've got data labeling. Accurate AI training requires labeled data, which is time-consuming and error-prone. Then there is a lack of interoperability. You've got a black box problem. Many AI models are not transparent. They provide outputs without clear explanations. And the impact of that is that radiologists may struggle to trust AI if they cannot understand or interpret its decisions. So an example would be a diagnostic model for brain scans offering an unexplained diagnosis, which may lead to hesitation in treatment decisions. So treatment limitations, we have to consider error rates. AI models are prone to errors, especially in challenging cases with atypical representation. And then there is adaptability. AI struggle with unexpected situations like rare conditions or unusual scan artifacts. For example, misrepresentation of scan artifacts in MRI due to limitations in the AI training data sets. Here you've got the dual energy CT artifacts. Okay, in evaluating the in large models that are used for questions in radiology, and that was reported in this year in Radiology 2024, they studied basically the AI compared to the radiologist reading. And I want to summarize this by saying that the radiologists and the residents that read the X-rays as compared with the AI, think about that. The radiologists and residents did not significantly outperform the GPT-4V. That's GPT-4 Vision. V is for vision. That's ChatGPT. Some of you have heard of it. Most of you probably have. And ChatGPT-4V is specifically for computer vision. So assistance from GPT-4V did not help human raters, however. So there are some limitations, and GPT-4V relied on the textual context for its outputs. So there are some limitations. And then, so if you look at all the pitfalls, and those were reported in American Journal of Radiology 223 in October of 2024, the anatomic variants are related, age-related changes, post-operative findings, medical devices, and imaging artifacts are all to be considered. These anatomic variations and the age changes and post-operative things that I've just mentioned, absence of such findings in the training data may result in biased model with suboptimal performance across diverse sets of findings or patient populations. There is also lack of integration with prior or concurrent image examinations. AI renders an incorrect diagnosis because, or may render an incorrect diagnosis because it has incomplete access to prior or concurrent image examinations. And then there is what is called satisfaction of search effect. Those of you that may have heard of satisfaction of search effect, here, this occurs with humans, radiologists. Detection of an initial pathology can stop the AI algorithm from searching for additional abnormalities, and that results in false negatives. And then there is lack of explainability. And I mentioned the black box earlier. The black box nature of some AI models may make it difficult for human users to understand how the algorithm make decisions, as well as create challenges in understanding. Then there is a communication gap. Insufficient communication between AI developers and radiologists can result in misunderstandings about clinical requirements and data interoperability. Now, the legal challenges will be discussed later. So the liability, there's unclear legal responsibility if AI makes a diagnostic error, and that will be discussed later. And this final slide is the integration with existing workflows, and that is the topic for a separate presentation.